So we're looking at the subspecialties of tests that can be done in a clinical laboratory. And this is just you looking at, okay, um, a different test is done, another different test is done, but all these tests are done to maybe diagnose conditions of the gastrointestinal tract. Do you understand? So you basically like you group these tests. Do you understand? So you group these tests and it makes it easier for you to actually know. So grouping tests is actually still something that they call what paneling, right? So that you call like test panels for bone disease. You want to check for osteocalcin. You want to check for other things, all right, that are related to the bone, all right. So those ones now will be called what test panel for bones. So now let's look at examples of these subspecialties of tests that can be done in a clinical laboratory. For example, see urinalysis. Okay. So now we see that a large array of tests in the clinical laboratory can be subcategorized into subspecialties of. You have the general or routine chemistry tests. Okay, and these are the commonly ordered blood chemistry tests like what liver tests and what liver function disease. For the liver test, mostly they check out for enzymes like the alkaline phosphatase, they check out for aspartate transaminase, they check out for alanine transaminase and the rest of them. Then we have the special chemistry tests, and these ones fall under what elaborate techniques like what electrophoresis and manual testing methods. And this electrophoresis is mostly like trying to look at the speed at which um, molecules move. Do you understand? And this can be used to diagnose correctly a disease condition. Then we have the clinical endocrinology, and this one is a test done on hormones. So instead of saying test done on thyroid gland, test done on parathyroid gland, test done on the adrenal gland, you just group them, okay, into a subspecialty under the clinical endocrinology. And this is a study of hormones and the diagnosis of endocrine disorders, okay. Then toxicology now is the study of drugs of abuse and other chemicals, right? Therapeutic drug monitoring, all right? This is the measurement of therapeutic medication levels to optimize dosage. So there are many drugs that I can use to treat the body, and there are different tests to be done to monitor the action of that drug. So all these tests, once it is to monitor the action of a drug, we say that it is a therapeutic drug monitoring, okay? Then urinalysis now, we said that chemical analysis of urine for a wide array of disease, very wide array of disease, along with other fluids like what the cerebrospinal fluid and effusions. Then fecal analysis is mostly for dictation of what gastrointestinal disorders. Okay, this is endocrine tests. Check for the various what hormones that we have in the body. Is a fecal test. All right, that's it. So these are what the subspecialties of tests that could be done in a clinical laboratory. I'll see you guys pretty soon.